Welcome to the Nursing Ministry channel. My name is Ludia Osita and I am a registered nurse. I set up this channel to help you understand what nursing is all about, whether as a ministry, of which we all are nurses, or as a profession. For the new viewers, I welcome you. If you feel lost anywhere within this episode, kindly watch our previous episodes in order to understand where we are at today, because each episode is a build-up from the previous one. And for the returning viewers, I welcome you once again. Thank you for joining me and interacting with us. And I know why you're here, probably to learn about CPR, but I will burst your bubble. I have decided to postpone the CPR to another episode, probably the one after next or the next one, depending on how fast we move in this episode. And the reason is CPR is a part of what I am discussing today. And you'll have a better understanding of the entire episode of CPR once you hear what I have to say today. So to jump right in, because I don't want to stretch us too long, our topic today is still on basic life support, but we're going to discuss the chains of survival. And this is our first part. Basic life support, as I said, are those subtle things that must be done or should be done in order to save somebody's life. That is why it is basic, not complicated, life support. We are supporting somebody's life, somebody who's losing their life. Now, when I zoom into the chain of survival, I'm talking about the certain actions that must be done to ensure the highest chance of survival of our victim. Remember, we had a victim, they're having cardiac arrest. Because we decided to start on cardiac arrest, even though I mentioned that basic life support could be performed on somebody with cardiac arrest, somebody with drowning, choking, stroke, anaphylaxis reactions. However, we started off with cardiac arrest. And then when we are done with that, we'll see about the other instances where we could apply basic life support. So since we started and we talked about basic life support, cardiac arrest, in our previous episode, today's topic, the chain of survival, applies also to the cardiac arrest. So now we have this victim, we have responded to the victim. What are these actions that we must ensure we are a part of in order to ensure that by the time this patient is discharged, their chance of survival is intact? Because we talked about our statistics, that 10% of the people whom the emergency medical services responds to, much as they may be alive, even taken to hospital alive, they may not make it to survival. They may not make it to discharge. Why? Because certain actions were missed out or delayed. And that is what I wanted to bring in. And then we will see where CPR, cardiopulmonary resuscitation, falls along this link. Now, we all know how a chain looks like. It is made up of links connected together. In our topic today, chain of survival, these links, each of these links is an element, an action that must be done. And so, if you've heard the term, a chain is as strong as its weakest link. That chain is as strong as every link, every strength of the link will determine the overall strength of that chain. And if there's one link that is weak or has a break in it, that is where the chain will break off. In real life, when you have a team or an organization or a family, the strength of that family, the strength of that organization or team is as strong as the weakest part of that team or organization or family. So if you have maybe 10 team members and their goal is to win a certain task or any sport-related activity, the one performing the least is the one that will determine whether this team is going to win or lose. Because the rest may be putting in all their effort, but if one person in the team decides to be lackadaisical or just relaxed, then the team will end up losing because everyone has done their best, but by the time it gets to this person and they are moving at a slow pace, the other competing team will overtake and win. So the chain is as strong as its weakest link. Now, what are these actions that make up this chain of survival now in cardiac arrest? Now, the actions, I'll call them elements. I'll interchange and call them links. So when you hear link, elements, or chain, or component, it's just part of one and the same word. Now, to understand better, whenever you have a cardiac arrest victim and you want to apply the chain of survival, which therefore, there are two major determinants. One, is this an adult or is this a pediatric? You have a victim of cardiac arrest. One determinant to know what chain of survival to apply is to ask, is this an adult or is this a pediatric? And the second determinant is to ask, is this cardiac arrest happening in the hospital or is it happening outside the hospital? Now you have to understand, cardiac arrest can happen anywhere. Whether inside the hospital, believe it or not, it can happen. Because inside the hospital, it can happen at the emergency department. You know, the entry to the hospital. That emergency department, somebody could have gone as a visitor, or you are a patient who was going in with another ailment. You are not feeling well and decided to seek medical attention. But on your way there, you get to the emergency room, and that is where the cardiac arrest gets you. It can happen there. It can happen in the corridors of the hospital. You may be a worker, maybe not even a visitor or a patient, but you may be a worker going about your work. You're in the pharmacy doing a thing. You're cleaning. Maybe you're part of the cleaning services and you're cleaning, but you have something going on within you. We'll see some of them. And that is where cardiac arrest gets you. So with your mop, you end up collapsing, and that is cardiac arrest going on in the corridors. Or it may be in the inpatient. You have been admitted, maybe you came in through the hospital, the doctor saw it fit to admit you. Now you're a sick patient, you've been there 2-3 days, this is your 3rd day, and then cardiac arrest happens while you're admitted in the hospital. Or even in the ICU, believe it or not, where you're closely monitored, but things go awry and then cardiac arrest happens. So you can see cardiac arrest can also happen inside the hospital. Now the other cardiac arrest now happens outside the hospital, whether in the parking lot of the hospital, the streets, the offices, the homes, the factories, the airport, anywhere outside the hospital. So in our chain of survival, one of the factors, the determinants on which chain of survival to apply, which chain to apply, is to determine, is this cardiac arrest happening inside the hospital or is it happening outside the hospital? Then secondly, is this an adult or is this a pediatric? An adult, in this case, we are talking about, the pediatric may include an infant. An infant is anyone below 1 year, anyone below 12 months. We consider that an infant. Then anyone 1 year to puberty, that is a child. By this, I mean this. For the infant, they are below 1 year. But we're not including the ones that are newborn, still in the delivery room. They've been born, they're still being cleaned and all, they're still in the delivery room. That is not an infant, that is another group. I'm talking about they have been delivered, they're outside the delivery room, maybe still in the maternity ward or recovery room and all. Those are, from there to 1 year, that is an infant. And then from 1 year, to puberty, so you look at your victim, maybe for the males, they have some chest hair, they have armpit hair. That one is now puberty. So any child that you find with that is more of an adolescent. You don't count them in as a child. So from 1 year to absence now, they don't have the chest hair, they don't have the armpit for males. Then the females, you don't see breast or armpit hair. That one is a child. And then one who has these signs of puberty to above any other age, that one now is an adult. So if you go and respond to a patient and you see these age brackets, then you know whether it is an infant, a child, or an adult. But for the sake of chain survival, we've broken it into two. The infants and the children are pediatrics. And then we have the adults. This is not difficult. Kindly follow me through and you will get to understand what I'm saying. And the reason is this. We need this age gap because when you're doing CPR, for an adult, you're putting pressure on their chest with all the force. You're using so much force on their chest. So you cannot put this kind of force on an infant's chest. There's so much you're going to crack underneath. You can't do this also on a child and do so much upon them because you can't put the same kind of force you do on an adult on a child. Again, they're still fragile. That is why we break it so that we will know also how to respond to each one of them. And that is why the chain of survival is determinant. Is this a child or is this a pediatric, which is the infants and the children, or is this an adult? So once again, I'm recapping. Chain of survival, two major determinants, whether it's happening inside the hospital or it's happening outside the hospital. And what is the age gap? Are we dealing with an adult or are we dealing with a pediatric, which are the infants and the children? Having understood that, let us look at the overview, the general overview. That is the elements. What are these components of this chain? Now, there are 6 of them. And the good thing is that it is almost similar for each of the, for the adults and the pediatrics, apart from slight differences. Now, there are 4 chains. One chain we apply to the adults. 2 chains for the adults, 2 chains for the pediatrics. Now, these adults where we have 2 chains, one chain is for the adult inside the hospital, and the other chain is for the adults outside the hospital. And for the pediatrics, one chain is for the pediatric in hospital, and the other chain for the pediatric that is out of hospital. So when there is a cardiac arrest of an adult, we need to determine, is this adult having this cardiac arrest inside the hospital? You are the visitor, you have gone to visit somebody, or you are going for something else to get a vaccination as an adult. You want to travel maybe, and you're walking in, but when you're walking on the corridor, you take a corner and you see somebody on the floor. Who is that person? You ask yourself, this is an adult. Maybe it's just obvious, this is an adult from the looks. Okay, where am I? I am in hospital. So there's a chain of survival because this is the adult in hospital. Or you're going about your business, you're walking in town, you're moving from one building to another, you've entered the supermarket, you've come out and all. So maybe you're walking down the street, you enter the bus. When you're seated in the bus, the person next to you happens to be unresponsive. So you check on them, you've checked your pulse, you see they're breathing. This is a cardiac arrest, but where am I? I am outside the hospital. Who is this person? Maybe the parent is seated next there, and the child wanted to sit next to the window, so they're seated next to you. Clearly, when you look at this child, maybe you start unbuttoning, there's no chest hair, there's no armpit. This is a child. If I would have found some chest hair on this child, then I'd consider them an adult because of these pubic-related signs. Puberty-related signs. So I have found a child in a bus that is outside the hospital. And when I check, there are no signs, so clearly this is a child. So we will use the chain for children or a child outside the hospital, just to give you a general overview. For instance, it was the mother holding a baby, and the baby was not well. She knew the baby was not well. I'll tell you why this one is related to not being well. So she's holding the baby, and the baby is unwell, and she starts screaming. And when you go and check, clearly this is a baby, because of course a baby, you know this is a baby, an infant. Or even ask mommy, how old is the baby? And she says they're just going to 1.5 years now. So when you check and responsiveness, you check pulse and breathing, this is a cardiac arrest on an infant. Maybe she says the child is 9 months, sorry, because an infant is below 1 year. So she says the baby is 9 months. Yes, but we are in a bus outside the hospital. So we have an infant who is a pediatric, because infants and children are pediatric, and we are in a bus. So that is outside the hospital. So we use this chain of a pediatric outside the hospital. Once again, we have 4 chains: adult in hospital, another chain for adult out of hospital. We have a 3rd chain, pediatric in hospital, and a 4th chain, pediatric out of hospital. You're probably thinking, what is this chain? Now, the chain is made up of links, components that I'm going to discuss, or elements. Now, there are 6 of them. And these are the actions that must be taken to ensure the highest chance of survival, whether it is an adult or whether it is a pediatric. They are all victims. They've all had this cardiac arrest. What are these things that we must do? Now, for you to know whether there are 4 chains, they all have these elements I'm about to talk about. Only that there's a slight difference depending on whether it's an adult or a pediatric, whether it's happening inside the hospital or out of hospital. Let's talk about them. The first element is prevention and preparedness. The second one is activation of the emergency system, early. Or let me restate it, early activation of the emergency response system. The third one is high-quality CPR with defibrillation. The fourth one is advanced resuscitation intervention. The fifth one is post-cardiac arrest care, and the final one is recovery. They sound like big words. Follow me and see how simple these are. Everyday occurrences. You will understand as I explain better. Now, the first one, which I said was prevention and preparedness. The second one, early activation of the emergency response system. The third one is high quality CPR with defibrillation. The fourth one is advanced resuscitation, post-cardiac arrest care. Let me restate that. The first one, we have prevention and preparedness. The second one, we have early activation of the emergency response system. The third one is now our high-quality CPR with defibrillation. The fourth one is advanced resuscitation intervention. Then the fifth one is post-cardiac arrest care. And finally, we have recovery. Now, before I go in, let me take you to the Bible, because I want to start with the first one, which is preparedness and prevention. In Genesis chapter 6, we have a man called Noah. He has a wife. They have 3 children, Shem, Ham, and Japheth. And these 3 children, sons, have their wives. Now, at that time, there was a lot of sin in the earth. The Lord had created the earth. He saw that it was good. Some were very good. That was man. And he was happy with what he had created. However, sin came in through Adam and Eve. And then it escalated to violence. The violence was so much. And it grieved the Lord that he had created, or he had made all this creation. However, there was one man who was righteous, and that was Noah. He revered the Lord, he feared the Lord, he loved the Lord, he served the Lord. So when the Lord thought of destroying the entire everything that had the breath of life, he just said, let me get rid of everything, and I will start afresh through Noah and the animals that I will send to him. So he told Noah of his plans. Noah was aware of it, and he told him, I found you righteous, and I want to send flood waters to destroy the entire earth. But I will spare you together with your family, your wife, your sons, and their wives. So what I need you to do is to build an ark. Build it with cypress wood. Cut it inside and out with pitch. Create rooms inside the ark. Let it have 3 decks, the lower deck, middle deck, and the upper deck. Then put a roof above it. Below the roof, put an opening, 1 cubit high, and then on the side of the ark, let there be a door. Then I'm going to send you animals, living things, two by two, a male and a female. You will take them into the ark to keep them alive. So go ahead and get all sorts of food that could be eaten and store inside the ark for yourself, your family, and the animals. This chapter ends with Noah did everything the Lord commanded him to do. Meaning the wood, he did not decide, I'm going to go with mahogany. He went with cypress wood. He coated the ark inside and out with pitch, as he was told. He put the 3 decks, lower, middle, and upper. He put rooms inside this ark. He put a roof with an opening all around 1 cubit high, and he put a door on the side of this ark. He went and looked for all sorts of food that could be eaten into the ark for himself and everything living that would be with him inside the ark. Now, this ark in subsequent chapters was locked. The door was locked by the Lord himself. Meaning Noah probably could have had screams outside, people screaming, knocking on the ark. He had no capacity to open that ark. It is the Lord who locked it. Meaning he could not open, even if he felt, oh my goodness, the flood waters are taking long, because the rains came, the floods came for 40 days and 40 nights. However, Noah did not leave after 40 days. All that water covered even the highest mountain. And it took a whole year for the ground to become dry again and for Noah to leave that ark. So what am I saying? Had Noah not done everything the Lord commanded him, water could have seeped into that ark and the ark could have sunk. Remember the Titanic? The ark could have sunk because maybe he would have done his own things, but he followed the commands. He prepared, and it prevented that ark from sinking. He went ahead and got food. Imagine if he didn't do that, thinking it's just 40 days, and yet he was there for a full year. From his 600th year to his 601st year, he was inside that ark. And he could open the door. Only the Lord could open it. So after 1 whole year is when the Lord opened it, and Noah was able to come out. So he did everything in preparation. And that is what sustained his life, his family, and humanity that you see today. On to our first topic, our first component or element of this chain, and that is prevention and preparedness. In basic life support, when you want to help a cardiac arrest patient, the first thing that is very important to even prevent that cardiac arrest happening is to prevent it. So how do the people in hospital prevent cardiac arrest? Like I said, it could happen there. So there are matters of, when you have a patient, we nurses receive patients who have cardiac-related illnesses, heart-related problems. This person has come in, when their blood was checked, they have high cholesterol, or they have already heart failure, their heart is sick, they have diabetes, they have hypertension, These already are pointers that this one they are like a bomb waiting to explode, and um, they need close monitoring. So that you do not assume it's just hypertension, let me give them medication. There's a way you monitor them closely, because a cardiac arrest could happen. They are candidates for cardiac arrest. So in hospital, to prevent cardiac arrest happening inside the hospital, we monitor their blood pressure closely, we monitor their cholesterol closely. If they're diabetic, we monitor their blood sugar closely to prevent a cardiac arrest happening. How about those ones still inside the hospital? How about preparedness? So how do they prepare for cardiac arrest? We have what we call drills or meetings that the medical providers do. So nurses, doctors, even pharmacists, those who work in the healthcare facility, they have regular practices that they perform. They do these practices. Or in our meetings, in some of the meetings you attend, you've gone for a meeting of something else, the manager asks you, Ludia, what is the chain of survival for a pediatric out of hospital? It is upon me now to go through it. The first one is prevention and preparedness. The second one is activation of the emergency system early. The third one is high quality CPR with defibrillation. I mentioned them. She may go further and say, okay, explain to us about the fourth chain of survival for this pediatric in hospital. I should be able to explain what it is, which we will discuss in depth in our next episode. So by doing this frequently, you are going to a meeting and you do not know whether you'll be asked about the basic life support for a cardiac arrest patient, and you do not know whether it will be a pediatric or an adult. You do not know whether you'll be asked about the adult, the one in hospital or out of hospital. So by reviewing this time and time again, we are preparing. Should there be a cardiac arrest patient inside the hospital, or I am outside and it has happened outside the hospital, I am prepared. I am prepared because of these frequent questions and reviewing. And then there are basic life support courses that are being held in the facility. So every 3 months, 6 months, although it goes on every 2 years, one is supposed to renew their certification, so that you're always in the know-how. There's not a time that you'll think, the last time I did this thing was 6 months ago, I've forgotten 1 or 2 things about it. Now that is one of the preparedness. The second preparedness is the drills, like I've said. They may do drills or just practices, or maybe they organize themselves. Of course, they can't do a real drill, but some do, some institutions, depending on where they are, they do them. Another preparedness is, if you have gone to hospital and you've checked on the walls of the hospital room, there's probably a button, a red button, sometimes it's blue colored. That button is for activation of calling somebody for help. We'll talk about it as our second element. But ensuring that such kind of things are working is also preparedness. Frequent checks, is it working? Testing it and seeing that, yes, should there be an emergency, a real cardiac arrest, when this button is pressed, the engineer should check that there is a response on the other side. That is preparedness. Then also reviewing what the system is all about in that facility. So when somebody is hired as a medical personnel, as a nurse or so, into the facility, they are taken through the protocol for that facility. What happens when we, as Hospital XYZ, have a cardiac arrest? This is our protocol. Of course, it is the same chain all over globally, but because not every facility is the same, one facility may be advantaged to have some of these system equipments and all, but another one isn't. Maybe they're in a rural area, they're not well equipped, but that does not mean a patient with cardiac arrest should die because they're not well equipped. However, they can have their own system of response that still follows this chain, which is the same globally. All right. That is preparedness inside the hospital. How about preparedness and prevention outside the hospital? Now we're talking about you and I outside the hospital, whether in the homes, in the offices, in our factories, in our airports, on the streets, in our buses. How can we prepare and how can we prevent a cardiac arrest from happening? Now, the communities in matters preparedness, the communities can be organized. Community means a group of people with a common goal. So the community could be a residential area, houses that make up maybe an estate, houses that make up a neighborhood. It can be the mall. That is a community of shops, people with shops inside the mall. That can be considered a community. Or the fire station itself, or supermarkets, the shops on a street, all that. So when we have these strategic points, they can have organized programs whereby they teach CPR, how to do the cardiopulmonary resuscitation. They can have, they have such programs. So they may come up with a program and say, every first week of the month, there is such a program to teach about basic life support, what to do in case of a cardiac arrest. Now, once they have these organized programs and people respond to it and they're taught about what I am teaching you right now, the public at large gets to be educated, they get to be informed about these things. So they're preparing, should anyone amongst them have a cardiac arrest, they have already done it over and over again. They know, even though one person may not know as much as the other one by one, is as that synergy already can give this person a higher chance of survival. So, organized community programs. Another one is public awareness. We, the medical team, go out into the community and we hold these programs. We educate the public. We go into offices. We go to schools, colleges, even the primary schools, because the child may be the only one available at that time. But when they know that the first thing you do is this, and you teach them the way children should understand, they get that knowledge and they could save a life, be part of this chain, be a link in this chain, be an element in this chain, and increase the chances of survival of this patient. So that is another thing, public awareness, going out into the community as medical personnel and educating the community, informing them, enlightening them, what is this basic life support and what do we do in case of a cardiac arrest. That is preparedness. And the third one, that is public awareness. Then the third one is having mobile apps and mapping. What do I mean? There are some mobile apps that are created that map where an advanced and automated external defibrillator is located. Sorry, I'm introducing this in vague way because I want to discuss it deeply in our next episode. Now, when I talk of mapping, that app will tell you where, to shorten it, let's talk about this as an equipment called an AED, Automated External Defibrillator. It is a lightweight equipment. Now, this is a lifesaver because it is made for the public, for people who don't have that medical knowledge. But it is used to shock the heart. Remember what I told you the heart could be like a car that you're trying to start and it's not picking, and it requires another car to come by and you put the cables to jumpstart the battery so that the car can start running again. So the heart, again, is like that car, engine, that battery that doesn't have a strength and requires something else to shock it for it to start. So that is where the AED comes in, the automated external defibrillator. It is lightweight. If you remember those toys long ago, maybe they still make them, they were like plastic. And then you press a button, it sings a jingle. You press another button, it turns to another jingle. It is that easy, it is that simple, but it does a lot because it is the lifesaver in this case. So having such kind of things whereby it is easy for the public to use, it has a button says power on, you press the power on button, and then it prompts you, now take the pads and place on the patient. You take the pads, and even on the pads it is drawn. This pad, there are two of them. One should be on the right upper part and the other one on the left part, and it is drawn to show you whether this is for a pediatric or an adult. Then it tells you connect it to itself, now the machine. You plug it in. Then it prompts you. You can now press the analyze button. You press, so there are just about 3 buttons. You press that second button, analyze. It checks the rhythm of the heart, the shock. Then it says this is shockable. Now clear, and press the shock button. So you look around, no one is touching the patient because you don't want to be shocked. Then you press the shock button. And the person's heart is electrocuted or shocked, so that now the heart can get back its electrical impulses. Now, having these AEDs, imagine having that in strategic points, but you need to know where they are. So maybe that is not even your neighborhood, where you know your neighborhood is in the nearest shopping center. So when you have that app and there's a cardiac arrest nearby, maybe in the house, you simply contact them that you need the AED. They put it, maybe for us in Africa, on a motorbike, and it gets to you quickly. Or it is sent quickly by whoever. But if you do not know, that is not your neighborhood, you do not know where the AEDs are located, that means you will go to the app to find out where is the nearest AED. So let's say I have gone to downtown and I'm doing my shopping, running my errands, and it has happened. I want to know where is the nearest AED. I will check on my phone and realize the next AED is in this supermarket right here. So mine is just to send somebody, go into the supermarket, let them give you an AED. There is a cardiac arrest here. So the supermarket can give it because they have already had maybe the public awareness. They've been told about these things. They have an idea that this AED is needed, so they can bring it on board to help this patient. So that is the importance of mobile apps and mapping to know where the AEDs are located. Another one is the same mobile, separate mobile app and text messages, but this time to locate people who have been trained in CPR and basic life support. So maybe there was a program, some people were not interested, they were not trained, or they were not available for the training, but there were those ones who were trained and they registered themselves. So the mobile app will be able to help you to send messages that we have a cardiac arrest. And if the people who have been signaled or get the text messages are somewhere near there, they may respond as helpers. Of course, the bystanders can also respond, and they're going to look at that. They may respond by you giving them instructions, because you can't keep on doing this on your own while the help is coming. You may get tired. So you can still use somebody else who is not trained, only that you instruct them what to do, how fast to go, how deep to go on the chest, which is high quality CPR. So in this case, the mobile apps and the mapping is for the AEDs, where are they located? AED for automated external defibrillator. That is to identify where the machine is located to help us in our CPR. And the mobile apps and text messages is to send message to someone, those who have been trained to come and help with the CPR, and they will check to see if they're near where you are and respond to perform high quality CPR. All right, we're still talking of how to prepare for a cardiac arrest. Public awareness, having these mobile apps, text messages, mapping, having these machines available is another one. When the AEDs are available in the communities, then it increases the chance of survival. Remember, we're talking of our first link in this chain. There are 5 other links. There are 5 other elements. But preparedness is having to understand, to ensure that these AEDs are available, so that we know that in the offices we have AEDs, in the churches we have the AEDs, because it can happen in church, in the parking lot of the church. We must be able to have the AED in these organizations. inside the homes, especially if we have a patient with diabetes, cholesterol, heart failure. Having them inside the home is also preparedness. Like we have seen in our scripture, Noah prepared just as the Lord told him. So preparing is not foolishness. Preparing does not mean we do not have faith in God. Preparing is biblical. We are doing it. We're not planning for disaster. We still have a place for prayer, and we're going to look at this at the next one, our next element. However, we need to prepare as we pray. That is wisdom. As Noah did, he listened to the Lord and he did exactly as the Lord commanded him. So that is preparedness outside the hospital. What about prevention? Now, cardiac arrest in children, in infants, and more or less in infants and children. The main cause for these little ones of cardiac arrest is not the heart itself, but something related to the lungs or the circulation in the body. So when there's a problem with the circulation, it could lead to shock. Not the shock that you know of, that I'm so shocked, oh my goodness, no. Circulatory shock. The way the blood is flowing and returning to the heart is not normal. And this can lead to a cardiac arrest in the little ones. And having a respiratory problem or failure, or lung-related problems or respiratory-related problems is what leads to their cardiac arrest. Unlike the adults, for the adults, it's more about the heart and the electrical problems I have talked about. So a heart failure can cause a problem with the electrical impulse, and that will lead to a cardiac arrest. Now, having understood that, to prevent cardiac arrest outside the hospital, we want to have a healthy heart, living a heart-healthy lifestyle. One of them could be diet, watching the diet. The protein, eating lean proteins like poultry, fishes, that can be healthy for the heart. Limiting salt and sugar, like I said, not stopping salt and sugar, but limiting, because food can be so tasteless without the salt, without the sugar, and now that can make the person not to eat and have enough nutrition. So limiting it. Limit salt and sugar, maintain a diet, lean, whenever we are taking protein, look towards the lean protein, poultry, fishes, vegetables, fruits, healthy diet. Then when we're using oils, consider olive oils, consider avocado. Those are healthy diets, just to touch on it. Then try and do exercises, regular exercises. So the exercise can be brisk walking, it can be strengthening exercises. As you do this, because when you're doing it, the heart has to pump. It has to do this. So when you're doing it, you're strengthening the walls, you're ensuring that there's a beating and there's no chance for a cardiac arrest. So regular exercises, whether brisk walking, whether strengthening exercises, and even if you can't do all this, any kind of activity helps towards this. So if you are maybe in bed, you're not able to do these regular exercises, there's still the lifting of the hands, stretching of the legs. But as you do this, it is a start before you pick up on other exercises. That is the second one, to prevent cardiac arrest. We've already talked of preparedness. The third prevention is regular checkups with your physicians, with the healthcare practitioners. When you go for the regular checkups and they are able to check your blood pressure, amongst others, blood pressure, blood sugar, cholesterol, they will see the trend. It was normal the last 6 months you were here, or last year it was normal. But now the trend shows that it is increasing. Either they start putting you on medication, so that it doesn't go higher. Maybe it's higher now and they're thinking you need medications to bring this thing back to the normal, amongst other things, exercise and diet and, So at that point, when you do the regular checkups, as a person who hasn't had cardiac arrest, you are preventing cardiac arrest from happening, because whatever is a risk factor can be picked up. Diabetes, what is the sugar? Blood pressure, how high or how low? Cholesterol levels. These are three major factors that lead to cardiac arrest. So that is the third thing. Regular checkups. Then also discussing with the doctor that in your family you've had quite a number of cardiac arrests and you're concerned. That is a genetic predisposition. So the physician is able to tailor your care, knowing that in this family we have a history of cardiac arrest. Then we could also go to preventing. Also, there is considering having an implantable cardioverter defibrillator, ICD. Now, in surgery, they put something on the heart. They do surgery, then now imagine an AED, but a tiny one on the heart. And then you go about. Now, because your risk was high for cardiac arrest, you do not know when it could happen. It's quite high. When you have that inside the heart, it's able to analyze whenever the impulse should go wrong and do what this external defibrillator could have done. But it does it because it has picked the signal that the electrical impulses are not normal. So let me do something and shock the heart back to normal. That way it prevents you from going into a cardiac arrest. But if we don't go to that extreme, then at least ensuring that you have this AED in the homes and in the office, in your workplace, so that should it happen in the home, you have one, and not just having them, but training the people around you to use it. That means the family members should know how to use that AED. At your workplace, they should also know how to use the AED. Should it happen, God forbid, you are prepared, just as Noah was. I think I have touched on a few. There are other ways to prevent a cardiac arrest from managing stress. Stress increases blood pressure. And when the blood pressure is high, you are at risk for cardiac arrest. There are also some hormones that are released in the body whenever we are stressed. So knowing how to manage stress. What is your stressor? Too much noise is your stressor. Look for relaxed areas. Maybe even if it is relocating your office space from the window where the traffic is too high to the inner part of the building where you can barely know what is going on around. Stresses like toxic relationships, toxic environments. Move away from it. Go and if once you know what your stressor is, what relieves it? What is it that when you do relieves it? So if you are in a toxic environment where the argument maybe is heated and you know that taking a walk in a quiet place helps you to calm down, relieves you, then by all means do it. Because remaining there makes your stress level to be high, the hormones are being released, the pressure is going high, and that is when you have your cardiac arrest. So knowing how to manage your stress levels. If you know working 6 days a week is not for you, cut it down. Do 3 days and rest. Ensure there is rest in between before you pick up again. So managing stressors is something else that you can do to prevent cardiac arrest. We have only talked about one link in this chain, and I'm seeing we are moving towards 1 hour. I don't want to stretch this longer than necessary. This is not a mere presentation. I'm teaching you life-saving measures. So I'd want you to understand, comprehend, and apply what I am teaching you. That is more beneficial than just listening, hearing, and doing nothing about it. So at least let me recap here, seeing that I cannot go through all the 6 links. There is still time. Let's meet in our next episode as I introduce you to our next topic, our next element in this chain. You have now seen, much as the term seemed big, these are things that you can apply. They are things easy to understand. And the first one I've talked about as a chain with 6 links. And this chain, I've said, these links I've said, they are actions that we perform to ensure that this person who has had cardiac arrest makes it to discharge and lives even longer. It increases the chance of their survival. And what are the actions? Number one is to prevent and to prepare. Just as Noah did, prevention and preparedness. He did everything the Lord commanded him. Not because he did not believe that there was God. He knew there was God to watch over him. But because he knows the importance of preparedness, he went ahead and did everything as commanded. So putting into practice everything I am teaching as much as possible is preparedness. And prevention is living a heart-healthy life. That in itself ensures that should cardiac arrest happen, God forbid, once again, you have the measures necessary to help. But we hope that it does not happen because you would have prevented it by maintaining a heart-healthy lifestyle. In our next episode, let's look at activation of the emergency system, early activation of the emergency system. This is whereby now we tried preventing, it did not happen, but we are prepared. Now that we are prepared and we are meeting a cardiac arrest patient, the patient we have determined this is an adult because they are past puberty. This is an adult. And where is our setting? We are maybe on the corridors of the hospital. I was going for my lunch break to the hospital shop, and I turned the corner and I found somebody on the floor. Maybe one of the cleaners is lying on the floor. I check, call them, no response. I've checked the breathing, there's no breathing. Checking the pulse, there's no pulse. This is a cardiac arrest. So how do I now activate the emergency system? I will shout. There is a way I will do it depending on our protocol. Each facility has their own protocol. Others use their activation codes. Others, you press a button. There are others that don't have anything, but they have practiced, they have planned. Should it happen, what do? You shout, you say this, you say that, and then help comes. That is what we will discuss in our next episode. I'm grateful once again. You've taken the time to interact with me, to listen to what you can do. Remember, it may not be you having a cardiac arrest. It may be somebody else in the home. However, it may not be your home because maybe you've been proclaiming and saying, 1,000 shall fall at my side, 10,000 at my right hand, but it will not come near my dwelling. I say a big amen to that prayer. That is my prayer too. It will not come nigh my dwelling. However, what if you go and visit somebody else and it happens in their home? Because 50% of the cardiac arrest that happens outside the hospitals happen in the homes. Out of all of them in the streets, buses and shops, and the 50% of this happen in the homes. So if it does not happen in your dwelling, somebody else did not pray that prayer. They did not proclaim that. So it is happening in their dwelling. You may not be in the house, but you are passing by and you hear somebody screaming. And when you go in, it is a cardiac arrest. Don't you want to give this person 100% chance of survival? Because if you do your part, it will determine how the next link and the following links and the others will be successful. If you do it wrongly, you do not activate that system early, or if you do not prepare or prevent it, or if you do not perform a high-quality CPR, you are the weakest link in this chain. The rest may do their best, but because you delayed or you did not perform your task, this person may not make it alive. And should they make it alive, they may make it alive with disability. You delayed in performing that CPR. That means you delayed pushing that blood to their brain. You remember I told you of these carotid arteries. They are going to supply blood to the brain. The blood is carrying oxygen. If you do not start early enough to send that oxygen, there'll be brain injury. If they make it alive, if they return into their consciousness, there may be brain injury. Their memory may be lost, or some part of their memory. Their movement may be impaired, so they won't walk as normal. And if you had delayed even further because you did not prepare, so you don't know what you're doing, you're all screaming. Some are praying. Yes, you pray as you work, as you do something, as you do what you prepared for. But if you delayed even further, the patient circulation may return, the heart may return, but guess what? Their brain is dead. The brain, you took too long to send oxygen and blood to the brain. So they are in a vegetative state. Alive, the heart is beating, blood is flowing through the body, but they are just lying down. They can't open the eyes, they can't lift their hand, they can't say anything. They are just there. Everything is being done for them, including breathing. It is a machine which is making their lungs to move. You don't want that for somebody. That they are alive, all you can do is see them, but there is nothing about them. If that machine for the lungs is pulled out, that is the end of your patient. Because now the heart there's return of spontaneous circulation. But they can't do anything. The brain cannot tell the lungs to do its thing. So you have somebody who has got no chance of life, and yet you are there. So join me in my next episode. Let's see what is the next thing that you can do. In the meantime, apply what I have taught you. Start finding out, do you have an AED? Where is the nearest AED? Is there such an app that maps? Are there courses for basic life support? Can my organization be part of this? Can we invite the hospital? Maybe not even invite. Can we take our employees to this facility that train with BLS? And then find out about this program. Take them to the courses, because during the basic life support, we as a medical team may be having a course, but who walks in? A manager walks in, a secretary walks in, they're not having any medical related background, but their company has sent them there to learn basic life support. That is being responsible. Noah did it. The Lord expects us to be prepared. There are so many other instances of preparation in the Bible, but because of time, I've just explained one of somebody who prepared and they were not swept to the flood. The ark did not sink. There was enough food for a whole year. So who are we not to prepare as we trust in the Lord? Hopefully in our journey on BLS, I will give you also my experience with a cardiac arrest patient who was inside the car at the back seat. So I'll tell you what I did. Hopefully, I will let you into my experience and how this patient survived by the grace of God. So ladies and gentlemen, let me cut off here. See you in our next episode. For the returning viewers, thank you very much. Come again. For the new viewers, once again, if you don't understand what this topic is about, there are other episodes, watch and learn. By the time you get here, you will be ready for our next episode as we journey together. May God bless you. I thank you very much. Have a beautiful day. Goodbye.